Hello, I'm Dr. Lin Vong. I am the Vice President of the Hackett-Hemwell-Patterson Foundation. Since 1969, our organization has been doing service learning trips to Honduras, where we teach doctors from around the world how to treat chronic musculoskeletal pain using prolotherapy regenerative injections. Since then, we have expanded to provide service learning trips that also deliver vein care and ENT services to other underserved countries. Today, I'm here with Dr. David Rabago to discuss HHPF's prolotherapy education and research. Dr. David Rabago is a family physician, clinician, and scientist at Penn State University. He was previously at the University of Wisconsin, where he founded the UW Prolotherapy Education and Research Lab, or the UW PEARL for short. Dr. Rabago is a world-renowned researcher. We are very fortunate to have had him as a past president of HHPF and a current HHPF board member. Thank you, Dr. Rabago, for joining us.
Oh, hi, Lynn. It's a pleasure to join you today. Thanks so much.
Can you tell us what is prolotherapy?
Prolotherapy is an injection technique that stimulates the body's natural healing response, and it treats injured, painful joints, ligaments, and tendons. The idea with prolotherapy is to reduce pain and improve function. It's been practiced in the United States since the 30s, at least, and is supported by a growing body of scientific evidence. Prolotherapy is also sometimes called regenerative therapy because its goal is to help heal injured and painful tissue.
Can you tell us about the UW PEARL?
For sure. The UW PEARL is a project of a group of academic docs who do research and education about prolotherapy. We've conducted some randomized controlled trials and some other studies testing prolotherapy for various chronic pain conditions. A current trial, for example, is testing prolotherapy for low back pain. PEARL also supports prolotherapy teaching through its work with the Gallagher Fund. We fund University of Wisconsin clinical trainees to attend training conferences and service learning trips that are hosted by the Hackett-Hemwell-Patterson Foundation and its sibling organization, the International Association of Regenerative Medicine.
That's awesome that we're able to do all that. You published a study in the Annals of Family Medicine on prolotherapy and knee arthritis that introduced prolotherapy to mainstream medicine. Can you tell us about those results?
Yes, this was one of our earlier and most successful studies in prolotherapy. For patients with knee osteoarthritis, we compared prolotherapy to placebo injections and at-home exercises over the course of a year. Participants in that study reported that prolotherapy safely reduced knee pain and improved their knee function better than either of those other two therapies. These results have been replicated by other researchers. Each reported that prolotherapy safely reduced knee pain and improved function.
That's amazing. It's great that patients now have an option for knee OA. I understand you also did a corollary study looking at these patients 2.5 years out. Can you tell us those results?
We followed those patients and some patients from a couple of other studies that we did out to 2.5 years. And we found that about 80% of them kept on improving for that entire time. Those are really strong findings in studies of knee osteoarthritis patients, which typically only go out to a year.
Can you briefly summarize the evidence for prolo in treating other conditions?
Yeah, prolotherapy has also been assessed for a few other conditions, including chronic low back pain, tennis elbow, rotator cuff syndrome, Osgood-Schlatter disease, temporomandibular disorder, and some others. Here, too, the results suggest that prolotherapy safely reduces pain and improves function. The important thing to remember is this. Across the board, the existing evidence suggests that a carefully selected patient treated by a skilled prolotherapist is likely to respond well and to experience decreased pain and improved function.
Wow, that's great that patients now have an alternative treatment for these chronic conditions. Can you tell me how do doctors learn these techniques?
So training has really varied over time. It's not always been part of conventional training. In the early days, for example, it was pretty informal. Docs really taught other docs. Some medical training programs now are starting to teach prolotherapy. Professional medical societies have also provided some training. For example, HHPF and its sibling organization, the International Association of Regenerative Therapy, or IART for short, have been teaching prolotherapy since 1969, and the last 25 of those years at the University of Wisconsin. Our annual conference brings experts from around the world to teach prolotherapy and also share scientific information. Teaching techniques are advanced, and they include marking and palpation labs and hands-on image-guided injections. We invite graduates of this conference to participate in service learning trips where they get even more training under direct supervision by senior instructors.
That sounds like an amazing way to be able to provide service for the community as well as transform medical education. So, you published also a review on prolotherapy service learning trips. What makes this type of regenerative medicine technique a good option to treat MSK conditions, especially in underserved countries?
You bet. Like we were talking about, the evidence suggests prolotherapy is a really good therapy for the right patient. It's also an inexpensive therapy compared with alternatives, and that's really important in situations where cost is a factor, including lower resource situations like low and middle income countries. Prolotherapy requires a skilled provider and a small number of injection-related materials. It does not require high-tech, expensive equipment, laboratory facilities, or refrigeration.
Very nice. It seems then like prolotherapy is a great addition to chronic pain care in a time when we need more options, especially non-opioid, non-surgical options. Is Prolo receiving much attention?
Little by little. One of the best parts about research is when prolotherapy is recognized by others as being good for patient care. Prolotherapy was identified in 2012 and in 2014 as being a practice changer for a couple of conditions, one Osgood-Schlatter disease and the other knee osteoarthritis, this by the Journal of Family Practice. That's also the most gratifying part about doing research, is when we can kind of get a toehold in real patient care in a way that matters to patients.
Well, thank you so much, Dr. Rabago, for all your contributions to the world with your research and being here today to share with us your expertise and knowledge. Thank you.
You're very welcome. It's totally my pleasure.